Hello everyone, welcome to our new series of webinars where this time our key opinion leaders have prepared something interesting to share with us. This is based on their personal experiences and with some practical tips for you. My name is Nilou and I'm the CAD/CAM Educational Manager from exocad. I would like to welcome and introduce today's presenter, Dr. Gulshan Murgai from UK. Welcome, Gulshan.
Hello, thank you very much.
Welcome.
Dr. Gulshan qualified in 2001 from University of Birmingham while maintaining his interests and skills in general dentistry, dental implants, and cosmetic dental surgery. Gulshan became passionate about digital dentistry and started his journey in 2003 with CEREC 3D. That's, I think, long before most of us. Today, not only he's the clinical director of his fully digital practice in Watford, but also owns a dental lab, which I have actually witnessed that he is constantly involved in heated discussions with his dental technicians who share the same passion as him. Also in our team, we have Michael Kohnen, the Global Application Support Manager in exocad. Hi, Michael. I think Michael wants to share some few words on the housekeeping.
Yeah, first of all, Dr. Gulshan, thank you for being here. Thank you for your time. We really appreciate that to have first time key opinion leader here in one of our webinars, and especially that that you are ready to show us something live today. That's really cool. I will try to answer to the question during your presentation, and as you said, you allowed me to interrupt you in case there's a relevant or interesting question, and then we can discuss it directly. And otherwise, we can do also Q&A after your demonstration, I guess after 45 minutes. And yes, I think the stage is yours, and enjoy. And
brilliant, thank you. Thank you, Michael. Thank you, Nilou. Also, thank you to the exocad team in Germany for basically giving me this opportunity. So the way we're going to start, I'm here in my clinic. I'm a practicing dentist. I finished with patients about an hour ago. We reopened after the lockdown situation about a week ago. And so what I'm going to do with you guys today is take you through a PowerPoint presentation that I put together, tell you about the product, about Chairside CAD, about how we have and how you can possibly join us in our digital journey, which for me is, well, 17 years now, doing Chairside CAD, not just design, but actually milling and such like as well. So as Nilou said, I started with CEREC, but I went towards the exocad products after having set up my lab 5 years ago. and we're going to have a look at where we go with this journey today. Michael, you are more than welcome to stop me at any time if I'm speaking too fast, or if people can't understand my accent.
Perfect. No, it's perfect.
Anything else. So here we go. So we're calling this Predictable CAD for the extended dental team, and let's go through it. First thing I'd like to do, because we have an American audience, is to make full disclosure. I am a key opinion leader for Vita with their Chairside CAD products, obviously with exocad, but specifically for their clinical products, and with Medit for the i500. I have another hat as well. My company, Implant Solutions, is a reseller for NT Trading, exocad, Sealodent, and Vision Tech printers, and also Woodpecker. So please bear with me. I don't think there's anybody that doesn't have some bias. I'm just making full disclosure of mine right now. Here's the surprise that I had for the team at exocad. They very kindly asked me to do this. I gave up my time willingly. I'm very honored to do it. But what the surprise is that I'd like to basically donate my fee to UNICEF. So that's something for exocad to do on my behalf. So I'm not making anything out of this. I'm sharing my journey with you, and this is for UNICEF. Okay, so let's look at who is in this extended dental team. You can see pictures of my team there. You can see my technician and I discussing cases. The extended dental team, for me, starts with front of house, your receptionist, people that are answering the phone, because they're the people that can tell inquiring patients that you do have a practice that's digital, that you may be different from your colleagues, your competitors nearby. So they have to be invested in this as well. Likewise, your practice manager, if they're going to help you manage your time and your skill and your earning potential, they need to know about these products and how they will help you develop your dentistry. Clearly, the dentist. I've put a few terms there that are specific to UK dentistry, but DWSI means dentist with special interests, and that's my category. I'm not a registered specialist at all, but my specialist interests are in digital and implant dentistry. The next person on the list is the dental surgery assistant or nurse. My team are very much involved in what we do with design, whether it's looking at margins, obviously with the preparation of the teeth, but also extends into the design process and the milling as well. There's no reason why you can't include hygienists and therapists as well. So when I've trained other people, I've certainly trained both hygienists and therapists, whether it's in scanning or whether it's in design as well. It really depends on which country you're in around the world. For instance, in the US, I know that there's availability for delegation to other team members that may not be available in some of the European countries. So that's something you can look at. Now, dental technician, that's my colleague, Andy, sitting up there discussing a case with me. And despite the fact that I've been doing chairside work for, as I say, I'm into my 17th year, I routinely generate a laboratory bill of around about 50,000 euros a year. That's me on my own. So it's not that I'm doing everything chairside, certainly not. I do, of course, appreciate the skill and the knowledge of dental technicians as well. The next item there is clinical dental technician, and they, are involved in our team for sure. And there's no reason why they can't be involved in digital. So that's what I consider to be the extended dental team. Now let's talk a little bit about exocad itself. I find when I speak, when I look at forums, when I discuss exocad with other dentist colleagues, that they say, tell me about exocad. And my question is, well, which part of it? Because a lot of people don't appreciate that exocad actually has three main software products. There's the chairside design, there's the lab design, which has been around for a long time, and there's also the implant planning and guide creation. So we have chairside CAD, dental CAD, and exoplan. Me personally, as a KOL for exocad, I'm working with the clinical products, which are chairside and exoplan. However, our lab does use dental CAD. So we're using all of those products. And what I've tried to show here in this graphic is that there's two elements to every single one of the products. There's DB, which stands for database, and then there's the CAD element, and I'm going to show you that as we get through the presentation today. Now, one of the reasons for me personally looking at exocad and this whole digital structure within my practice when I moved away from CEREC was the completely open nature of exocad and its product catalog. So they're open in that they speak to intraoral scanner manufacturers, they speak to people involved in large and small dental laboratories, they work closely with 3D printer manufacturers as well as people that are making hardware and software for jaw tracking, lab scanners, milling machine manufacturers. They really do integrate their product with as many other people that are prepared to share and go ahead and spread the word, spread this joy of digital. So for me, it was an easy choice going to exocad because I can pick and choose what I wanted to use in terms of hardware and then use their software, which brought it all together. And I'll be demonstrating that today. So the structure of Chairside CAD is a modular structure. So there are 10 modules. There's your base module, and then you pick and choose what you would like to have within your package. So if you are doing implant restorations, you can choose to buy the implant module. Likewise, if you are going to invest in a 3D printer, you could have the model creator module and so on. There are other things there, such as the DICOM viewer, and then there are other tools which help you even in your basic design. So there'll be auto articulator, there's True Smile, and I'm going to show you those when we get into doing some live design shortly. Okay. The other thing that you can see there is the Smile Creator module, and that's very useful for people that are doing multiple anterior cases, and it comes from the lab software. In fact, all of these elements have been brought in from the lab software called Dental CAD, and they've been made more friendly, easier, and quicker to use for a wet-fingered dentist like myself, so that you can actually do profitable dentistry and in a same-day type of situation. Let's move forwards. So, clinical uses. Michael, how am I doing? Am I speaking too fast? Michael's gone for coffee, I think.
No.
Right.
Just took some time to switch on the camera again. No, it's perfect. So there's nothing.
Clinical uses, really very similar to CEREC, but then more as well. So we've got inlays, we've got onlays, we've got anterior and posterior crowns, bridges. Well, we'll touch on that later on, but also veneers. Bite splints is something a little bit different. So if you have 3D printing, then you can manufacture your own bite splints. Implant restorations, we're going to show you one of those today, and smile design. DICOM integration is great for, obviously, if you're doing implant planning and implant restorative cases, it's a really useful module as well. All of this is kind of graphics hungry, so it's really important that if you choose to go down the route of exocad or any other CAD software, to have a good computer that can run all of this and it becomes seamless. So we have dedicated laptops and desktop computers for CAD, and if you do that, make the investment properly, it becomes easy and actually fun. So for me, I'd like not to have a single day when I don't do any digital, you know, it's a daily occurrence. So these are some examples, these are some stock pictures from exocad. On the left-hand side of the screen there, you can see a large bridge. So despite the fact that this is Chairside CAD software, and unless you had a big disc milling machine, you could design that, you could then farm it out to your, or subcontract it out to a milling center. On the right-hand side, you've got a 3-unit bridge, which you could certainly mill in-house with the appropriate block of material. So a few options there. Moving forwards, we've got a implant restoration here. So on the left, there is a implant bridge on 2 fixtures. In the middle is a single unit, and on the right-hand side is a combination. So these are all possible to do, and these are cases that have been done with Chairside CAD. Again, just a graphical overview of different types of crowns, whether they're single, multi-unit. In the middle there, you can see the bite splint, very, very predictable to produce bite splints these days. There are some beautiful 3D printing materials coming out, so not just your hard acrylics, but also your softer materials as well, becoming very popular, I know, in the US. And of course, there are ways of doing quadrants. So you can take a quadrant and do 3 or 4 restorations, whether that's anterior or posterior, can be done in a single sitting. Now, I touched on earlier about the fact that exocad is wide open, and you can see images on here of the data acquisition. So the data acquisition would come from usually an intraoral scanner. We've got the Carestream there. I've got one of those. There's a 3 shape in the middle on the top right hand side. That's what I'm using currently, which is the Medit i500. We have a Linetex Itera product, Plan Mecha, and even Sirona. So, you know, even our friends at Sirona have realized that, you know, they are losing market share, and actually having some contact with the likes of exocad, which is gaining popularity worldwide, means that they're showing willingness to actually get involved and open up their software, which was closed for decades. So this is all to do with, let's say, consumerism forcing the open structure of hardware and software, and I think it's beneficial to all. Now, let's move forward. Once you've acquired your data and you have that within your software, the next thing is design, and I've said design plus or minus production, because there are some people that will say, well, look, I'd like to have control of design, and let's face it, like myself, many dentists out there are control freaks. They like to have some control over a little bit of everything. So you could do the design and then push a button, and on the right hand side there, the button is Dental Share. It's part of exocad Chairside CAD, and it's a way of sharing your designs and collaborating with colleagues, with labs, with your support team, so that you can say, hey, have a look at this, or you can say, hey, I've designed this, but I don't have a milling machine. Can you handle that for me? So design plus or minus production. You can take your investment in stages. You could go ahead and start scanning first, get used to that, get happy with your scanning technique, and then look at buying exocad, start your design, get used to doing design, have someone else do the milling, or you can jump straight in and have a good support structure behind you. So once you've done your design and you're happy with it, the next element is to nest those designs. And what I mean by nesting is you've got to then work out how you are going to fabricate those, whether it be 3D printing or milling. And this is all built into the Chairside software. So whether you are nesting into a block or nesting into a disc, depending on what hardware you have, this is the way you would do it. And this part of exocad Chairside CAD is called exocam, CAM being computer aided manufacture. It's very important that I tell you that in choosing this kind of workflow, you have a huge possibility of materials available. And this is growing regularly. Every time I go to IDS, I see more and more materials being released, and more of them are being released in block form. That tells me that the manufacturers of these materials are appreciating that more and more people are investing in actually doing this kind of chairside CAD. So you have an array of materials there, from lithium silicates, disilicates, you've got your PMMAs, you've got your glass ceramics, your feldspar, lots of different options there. And the one that's growing the most actually is the middle option there, which is the hybrids. My choice personally, you saw earlier, I'm a KOL for Vita. I've been using Vita products in my practice for 15 years now. And in doing so, I can show cases that have been in the mouth that I've got x-rays of and I see regularly every year, and I can see these restorations lasting. So then I have no reason to change my product. So I work very closely with Vita, and you will see more of that soon. The next element is, if you choose to actually mill in-house, well, the Chairside CAD product has been designed so that where they've collaborated, where exocad have collaborated with partners such as VHF, Roland, IMS iCore, and Armin Gearbach, who make a group of machines that have different labels. Well, these machines we know work with Chairside CAD. They've been validated, so to speak. My preference is the one on the far left, the VHF, but the others are also very good and they work very, very well. So if you choose to mill in-house, these are the kind of machines that you would look to invest in. And it's very important that you look to invest in specific machines that are designed for Chairside CAD, The reason being that typical lab machines tend to work much slower. So where you could use one of these machines and mill out a restoration in 10 to 15 minutes, a lab side machine might take 20 to 30 minutes or more, because they tend to be workhorses that do a lot of work all through the day, whereas these machines are designed to cut fast a few times a day. So it's important that you look at the right products. Next step is, again, one of exocad's collaborations. They collaborated with 3D printing manufacturers, so not just with the resin manufacturers, but also the machines. So we have the NextDent product, we have Sprint Ray, we have, of course, Envision Tech, which is something that we resell in the UK, and of course, Asiga. All of these very popular machines worldwide. And you can rest assured that if you invest in Chairside CAD, that they've already looked at this for you. They've already ensured that your previous investments or your future ones may allow you to integrate Chairside CAD. Okay, so now we get into the part where I'd like to show you some real life cases. These are literally scans that I did last week. The first two scans are upper and lower jaw scans. This is actually my practice manager, and around about 2 hours ago, I just fitted the crown, which I designed myself with Chairside CAD. It's the lower right first molar. The next two scans are one of my patients. This is a upper lateral incisor. This is me just showing you the quality of data that I would expect to see from acquisition from whatever intraoral scanner you have. If you can get this kind of quality data, I will show you soon how you can bring that into exocad and utilize it to make predictable, nice fitting, really good looking restorations. Here's one that I fitted earlier this week, actually. So this is a quadrant scan, upper right. On the far right hand side, you can see the lower right. I do a lot of onlays. I do a lot of endodontic treatments. So this is a patient who had their root treatment done before lockdown, had a temporary restoration for all of that period, which was about 9 weeks. And earlier this week, we did the preparation, scanned, designed, and milled. In the middle, that is a monochrome, a look at the restoration that we fitted. This is another case. This is from last week. Again, lots of people coming back off lockdown and wanting to finish the treatments that were started. So this is a combination case where we have a crown going on the tooth. This is the upper right premolar, as well as 2 implant restorations. So with my scanning and with my power of exocad Chairside CAD, I can go ahead and scan the patient in one sitting and go ahead, and in a case like this, I wouldn't do it in a single visit. I may do the crown on the tooth in a single visit and send her off to come back to have the implant restorations, because that takes longer. But the point is that data acquisition is in one hit. Acquire data, impress your patient, educate them on what they can see on the scan. So you have a multitude of different fillings, materials, there's some veneers there and such like. And we ensure that before they leave the room, they see what we were doing in collecting that data. Here are a series of other scans. Again, these are all very fresh. They're from the last 10 days. And pretty much all of them are cases where I've done root treatments on very broken down teeth to stave them, to restore them. And you will see from the other cases that I show you that we do take it to extreme. And I'm quite certain that if I can show you what extremes I can take digital CAD/CAM to, that if you start with straightforward cases, you will have no trouble at all. So on the far left there, we have a quadrant, 2 molars being done together. The next one is just a single molar. Then we have a premolar and then another molar, but they're all similar. I have my protocols and I do the same thing over and over. It's very predictable. Now, we've talked about data acquisition. We talked about scanning. Now we look at design. This is a case that was done probably 6 or 9 months ago. Again, it's a quadrant, so it's an upper left 7 and 6. So these are first and second molars. There's an onlay and a crown. On the middle image, you can see how in exocad I have used the software to design. You can see what it looks like in monochrome there. This is the same case in color. So when you're looking to make this kind of investment, if you don't have a scanner already, I would urge you to ensure that your scanner that you purchase is a color one, because when you have this kind of information on the screen, not only does it become an educational tool for you to educate your patients, but it's also a sales tool, and it's also helping you in picking up margins and differentiating between different tissues in the mouth when it comes to design. So color for me is the way to go. There are still a few monochrome scanners out there. I said that I take things to extremes. So if you look here at this case, this is one patient who hadn't attended for 14 years. She didn't actually have pain with this upper first molar, but any dentist looking at this will straight away see that tooth is pretty much destroyed. Bottom left-hand side is the clinical image of how she presented, and you can see when I removed the mercury amalgam filling, she had cracks, and of course this is a pretty poor prognosis tooth. However, this lady did not want to even consider an extraction, too scared to consider a sinus lift and implant. So I said, okay, let's see what we can do. Top left-hand side, you can see my endodontic result. She was then left with a temporary restoration there, temporary filling for around about 2 weeks, left out of occlusion, and then she came in for multiple teeth in one go. And I will show you that later on. This is another similar case, and when you consider doing these kind of extreme cases, it's most important that you know how to manage soft tissues. This is not just about prepping the tooth well, but if you're going to do nice cosmetic restorations, it's important that you can make your margins disappear. Now, I use a combination of chemicals, so you can see lower left-hand side, that's an American product called Traxident. I use laser, diode laser. I would use retraction cord, as well as astringent agents to control any bleeding. And in doing so, you can see on the bottom row, the middle image, that is 3 to 4 millimeters subgingival, but you can see there's no bleeding there. That's from picking your patients well, scanning in a relaxed environment, and ensuring that you have tricks up your sleeve to manage soft tissues. This is the same lady that I showed you before. Far left-hand side is the endodontic result. Again, we are probably 3 to 4 millimeters subgingival, no bleeding, nicely clotted. That lady, after her endodontics, came back and we did 3 teeth in one sitting while she waited. So 2 molars opposing each other and a premolar. In the premolar case, you can see that I've actually put some retraction cord in there as well. Same case now, into exocad. This is the design structure, and you can see those same 3 teeth being prepared at different stages. And when you show this kind of thing to a patient and you say, this is what you've got, and this is what I can do for you, give me an hour and a half and I'll fit this for you today as well. They are typically patients that stay with you for life. If you can do this for them well and look after them, they're hugely appreciative. So let's see, we also have color images of the same case, and you can see there that the proposed restoration there is in the tooth color that we've chosen. And again, that's important to use to educate the patient. So that's a little bit more than a quadrant case. That's opposing arches in the same single visit. So this is the power of exocad, all from one set of upper and lower scans. Here is another similar but different case. This is upper left-hand side, a first and second molar combination. Again, endodontics on one, non-endodontic on the other. And here's the same thing in color. Again, very, very deep. I have no trouble handling these cases as long as the patient knows that we take it in stages. We will dismantle the failing tooth and make sure that we have enough structure to bond to. A lot of this kind of work is, well, all of it is metal free. So you have to be confident with your bonding techniques if you're going to undertake this kind of work. Well, thank you for listening. That was the first part of what I wanted to say done. Michael, do you want to tell me if there's any questions while I switch over to exocad now?
Yeah, there was one question so far, which is not really clear. Maybe we could also discuss about it when you are at the step in the software. Question was about how do you select your scan bodies, but I've asked this person to explain a little bit more what he means, if he's talking about the brand or type of scan body. I don't know, maybe.
Okay, that's the kind of question, that's the kind of question I get regularly, because we're a supplier of implant components. So yes, I'm biased, but I'm also educated in it. So the simple answer to how do you choose your scan body
Okay,
is...
sorry. Now he's explaining it. So within the same implant system, is there a difference in scan bodies, for example, diameter, etc.? Yes. Okay, that was the
Yes,
question.
there is.
No.
So typically, when you choose what type of restoration you're going to do on an implant digitally, it's really important that you know what you can do with it. So usually, chairside, people are going to take a titanium base and they will mill a crown, bond the two things together, and it will become a screw retained restoration. And I'm going to show you one of those in a few minutes. So going back then to the question, the way that you choose your scan body is really simple. It's got to be matching to your implant. So some of them are specific to the diameter and the connection of the implant, but also it's very important that whoever supplies your scan body supplies the titanium base and also supplies the file set that goes into exocad. So there are three things that are needed: matching titanium base, matching scan body, and the files that go with it. So all of the producers of these type of components also produce the files for exocad and the other softwares that are out there, so they're integrated. I hope that answers the question.
That was a perfect answer, I guess. Yes.
Okay, so let's start with something simple. We are going to do a crown. So this is the DB side of Chairside CAD. I'm going to speed things up a little bit now. I hope you don't mind, so I don't overrun. So here we're going to use sample cases, and I'm going to use this particular sample, which is a lower crown. So it's a lower right side premolar. I'm going to just load that because we don't have time to scan and go through the whole thing today. So just to show you quickly, on the left-hand side, this panel is where the assistant or the dentist themselves would have the opportunity to place the patient name. You have a window where you can place notes about the case. In the middle, where it says job definition, you use these teeth to mark the data that you're going to give to exocad. So in the middle, you can see the legend, and it tells you that orange signifies antagonist. In the lower jaw, the gold color signifies an adjacent tooth. And now the important one is what we will call the working tooth or the prep tooth. And that one in this case is purple, it's anatomic crown. Let me show you what happens when you click on that. So any tooth that you click on, it will open up these options. Again, it's split in three. So on the left, you have your, let's call them your basic functions, your core functions. So crowns, inlays, onlays, veneers, okay? If I click on the button that says more, that's everything that you can do with Chairside CAD. There are a lot of options. So clearly bridges, inlays, onlays. If you are someone that's skilled and you can build up ceramics, you can even design and fabricate your own copings as well. Bite splints, it's all in there. So to keep it less complicated, we just show the basics. So far left, we choose the type of restoration. In the middle, we have the choice of our type of milling machine or 3D printing. Below that, we choose the type of material. And now the really important part is here, is on the parameters section. And within the parameters, we decide, is there an implant or not? And then we look at things such as material, minimal thickness of the material, but also the gap width of cement. Some people prefer a very tight passive fit. Other people prefer some wriggle room. Maybe it depends on what type of cement they're going to use. So they're the basic parameters. Below that is advanced parameters, and this is where you get technical. This is where, if you want to, you can get very technical and change all sorts of things such as emergence profiles and angulations and such like. We can touch on that later on. So we've defined the case. We go ahead and click on design. As I said, in this particular case, the data is already there for us. It's a sample case. Now, that was DB. By pressing design, I've now opened the second part of the software, and that's called Chairside CAD. The pause is because it is checking the security dongle. All of these softwares have a security dongle, and they're programmed with the modules that you've purchased. So let's start from scratch. Raw data. Here we go. Something to show you is this thing. This is a 3D mouse, which I tend to use in my non-dominant hand, and then a regular mouse with a scroll wheel on my dominant hand. So I can use both or a combination to manipulate the model on the screen and also to actually use the design tools. So here we've got a really nice preparation. It's clearly a real case. It's not one of mine, it's a sample case. Nice preparation, clear margins, and no doubt they've either troughed it with a laser or they have used retraction cord. Regardless, it's clear to see the margins. Now, when it is that clear, I'm going to show you how fast and powerful you can be with exocad. So let's speed things up. Left-hand side panel, we have a button that says detect, and this will automatically detect the margin. Literally, I'm going to click, well, actually one dot on the margin found the entire margin, and if I show you that and zoom in, it's very, very accurate. I didn't need to place the second one. So if I press clear on there and go ahead and do a single click again, it's found it straight away. So I think that's quite impressive. However, you have to prep well in order to do that. Otherwise, you could use manual tools to mark the margin. We click on next. The next question the software asks us is, tell me where the insertion path is. Now, what I can do is I can move the model around, and it's really important to understand what this is showing. So what it's showing is that if I turn that way, you'll see on the mesial aspect of the tooth has gone red, and likewise if I go the other way. So that would be building in an undercut, which will obviously cause a problem. The important thing to see is that there's also undercuts to take care of from the adjacent teeth. And exocad shows you that. You can see the yellow area highlighted on the adjacent teeth. So you have to make some kind of compromise or adjust the adjacent teeth when you come to doing the preparation. So I'm happy with that path of insertion. Click the button that says set current view as insertion axis and hit next. Okay. So the software has now used the parameters that I showed you in DB to set up some safety elements. So you can see on the top left-hand side here, I've got antagonist, jaw scan, minimum thickness, and design parts. These are the parts that make up the case so far. I now have a proposed tooth, and that's from the generic library. The library is down here on the bottom left-hand side, and I can choose from different libraries that are available. For this case, we will keep it to generic. There are colors now shown on the crown, and they signify contacts. Personally, because I'm milling on site, I like that to show proximity. I can also ask the software to show me the contact strengths of the adjacent teeth, and that helps me in setting up the occlusal scheme. So with a few movements, I'm using the left mouse button, and I'm going to move the crown around, and you can see the contacts and the colors are changing. Quite happy with that. If I hit the keyboard button marked A for antagonist, it brings in the opposing teeth, and I can see, yeah, I'm pretty happy with that. Now, this is the impressive part. If I click on next, what's going to happen is it's going to start off what's called auto articulator. Again, this is one of the modules, and you will see that the software has automatically processed the design according to lateral and protrusive movements. So it's done all of that for you to a set algorithm. Now, if we take away both models and we take away the colors, that's quite a nice looking restoration already. Now, that's pretty much done. We don't have a lot more to do now. Typically, what I do next is I use the free-forming tools here, starting with smooth, and I'll just go around and smooth everything off. Now, I'm sorry if I'm offending any of the exocad developers, because they will no doubt have their favorite way of doing it, but this is mine. Let's switch the colors back on, and we can increase the contacts, we can decrease them. So pink is the way I like it, a little bit of pink there. We can change the size of the tool, the action of the tool. That's pretty good for me. Now, let's say I had a high area here, like so. You can also use automatic tools such as adapt. So if I say in the adapt tool to adjust that occlusion so that the parameter is 0, so that we just have point contact, and press cut intersections, it's taken it away in a second. So exocad's done everything they can to make it intuitive and easy to use. Like everything else, there is a learning curve, but I'm pretty happy with that. One more thing to show you here is that
Okay, yeah, I have a question here myself, maybe. What do you
Yeah.
think about, okay, you just activated it, so I don't I don't need to ask the question anymore. It was about the true smile, in fact, yeah.
Yeah.
What do you
So
think about that?
I suppose I have my routine when I'm training new users, Michael. So this is when I tend to bring in True Smile. So the benefit of True Smile, what I did there was I turned off the colors as well. So if you have a color scanner, you can turn the colors on and off. That sometimes helps with margin detection, but also True Smile will help you in, let's take off these distances. You can really see the fissure pattern really nicely with True Smile, so that helps. Let's hit next, and we're almost finished with this case. The next thing we're going to do is what's called nesting. We're going to choose from our materials. This particular one was set for lithium disilicate. So let's see, let's try and look at a multicolor one. Okay, so we could go with this one. Okay, once you choose your block, it will superimpose the block onto your design. What you can see on the lingual aspect is the sprue. So when this block is in your milling machine or your lab's milling machine, it needs to be held with a sprue which can be trimmed off. You can move this around so that you can fit in the restoration accordingly. This is part of exocad, which comes with the package. On the left-hand side, you can see that you can also control the speed of milling and the quality, and you can also put in notes about the design and the lot number and things like that. So the software, as I said earlier, is connected to the milling machine. If I hit next on here, it's going to finish that proposal, and there you can see our designed restoration ready to mill. That is now an STL file ready to go. Single crown, as quick as I could do it whilst I was talking you through. Okay, Michael, I know we've got a few minutes. I'd like to quickly run through an implant case, if you don't mind. Have we got time? 5 minutes?
Yeah, that's perfect. You have as much time as you want. Actually, there are no more questions so far.
Fantastic. Well, either they've all run away or they've gone to sleep. We'll find out later on.
No, they are still there, but
Okay, fantastic.
maybe you're explaining it perfectly. That's maybe why there's no question here.
So I'm going to load up another sample case here. As you can see, it's described as a screw retained crown. I did design it earlier, so I'm going to just take it back to scratch and show you from the start. Again, left-hand side, name of the patient, any notes that you'd like to put in. In the middle panel, you designate your job description. So let me go into this one in a bit more detail. We click on the working tooth. It's clearly an anatomic crown. It's going to be milled on a 3-axis or 4-axis machine, cut in feldspar. That's not exactly a good idea for a screw retained crown. So let me see if I can change that to a hybrid ceramic.
Okay, that's maybe just as we're just talking about the materials here, there is just an incoming question. Once the crown is designed in exocad, do you require another software to mill the crown using the VHF milling unit?
No, as long as it is the VHF Z4, which is a validated machine with exocad Chairside CAD, then actually you can control it all through Chairside CAD, because as part of the basic package, you have exocad. It's running in the background. I'm a bit of an expert with VHF because I have 2 or 3 of their machines, and we resell them. So with VHF machines, they also come with their own CAM and CNC softwares. So if you want to, you can do that. It's more complicated, but the answer to the question is it's built into Chairside CAD as long as it's the Z4 machine, because that is a specific Chairside machine. Does that answer the question, Michael?
Yeah, perfectly.
Brilliant.
Thank you.
So let's get back into this. We're looking at changing this to a hybrid ceramic, and I'll explain why later on. We're going to make it a screw retained crown. You could see there are other options as well as custom abutments. And I'm going to leave the rest of the parameters alone. Maybe I'll put in a shade, A2, and click on OK. So that's been changed now, and very simply, in the lower jaw, we can see we have some antagonist teeth. Because I changed it, these buttons on the right-hand side are inactive now. In order to reactivate them, we have to press save, and they will light up. So there we go. I hit design, And that's now going to open up the CAD software, and we'll get into doing this design. Nilou, any questions from you?
Actually, I was wondering if you have a chance to show us the website where they can find all the information about the libraries. I know you're the expert and you know where to find them. It's on exocad.com.
Definitely.
When you got a chance.
As soon as we get to the end of this, I will show you that. exocad's made it as easy as possible to integrate the implant workflow. So there are a team in the development section who actually speak to the manufacturers, the actual implant companies, and there are literally thousands of files there. So let's crack on with this. We're going to load the scan data. You notice I had another option there which said load scene file. So if you've designed a case before, exocad will remember that and give you the opportunity to load the same one. If you'd like to start from scratch, as we're doing here, we do so. So what we have here is the intraoral scan, and we have the scan body. This particular scan body is one that exocad have labeled. This is a test case. So the first thing the software will ask us is, which scan body is it? Now, in most cases, it won't say exocad chairside demo case there. It would say Nobel, Straumann, MIS, whatever system you're using, it will be listed there. So we're going to say it's the exocad demo case library. We're going to say that here we're going to do a screw retain crown, and look what happens. You get a library file appear. Now I can rotate that around so that I can check the orientation. And what the software is asking me to do is place that red dot on here in the model in the same place as it is on the screen. Very simple, single left click, and you can see that what it's done is it's superimposed the library file onto the scanned file. We click the button that says best fit matching, and you can see what's happened there is it's matched it up beautifully. Excuse me. I clicked on the next button, and what happened is, because that data set was made of 2 maxillary scans, so one of the patient as they are without the healing abutment, and the second with the scan body in place. So the software has now peeled away the scan abutment, and it's saying, okay, it's now superimposed the titanium base. Okay, and the titanium base is what's going to allow this to become a screw retain restoration. Inside here, we can see, whilst this is a monochrome scan, it's a very nice clear one. We're asked to draw out the emergence profile. Very simple, using the left mouse button. We can go ahead and move around the inside of this margin and say, yeah, this is going to be my emergence profile. To finish, double click. And if I need to change any of that, move it up or down, it's very easy to do so with these control points. Okay, let's click next. And here is a great opportunity with this software. It's very important when someone loses their anterior tooth or any tooth that if you have the opportunity to copy the contralateral one, that you do so, especially so with an anterior. Look at how easy exocad has made this. Now, we have the opportunity to copy a tooth or mirror a tooth across the midline. Obviously here we're going to mirror it, and we'll copy the right central incisor. Now, what I personally like to do is keep a virtual pre-op. That means when I've copied it, it puts it in the library aside so that I can use it and switch it on and off. And it's very simple. We literally single click on the tooth, and you saw within a second, it's copied it. Now you can see it's mirrored it, so it's flipped the tooth, and I just throw it down into the right position. I can then position that, so I can bring it up. I can use my tools to rotate, tilt it anywhere I like, and I don't have to spend too much time on this particular window doing it, but you do get an opportunity later on as well. So that's pretty good. I'm happy with that alignment. Click next. The software has automatically now recognized and highlighted the adjacent teeth. In turquoise there, you can see my virtual pre-op, the copy. I can switch that off. And now it's allowing me, it's saying, well, you've got a copy, just in case, here you go, you can choose one from a library as well. Once again, it's set to generic, but I could change that. And as I did with the single crown earlier, I'm going to just go ahead and move this around. Now, anyone that does a lot of anterior cases can see that in this particular case, the space that we have is actually wider than the contralateral tooth. So we are always going to end up with a slightly wider crown there. But rather than something coming back from a lab and then the patient being upset, here you can have the patient sitting beside you and say, Madam, or Mr. or whatever it is, here you go, you can see my problem. You know, you can communicate with your patient and say, you're on the journey with me right now, you know, that this is what I'm having to overcome to get you your aesthetic demands. And I'm sure most technicians would agree that if they could have a patient actually sat next to them and explain to them what the complexities are of their case, life may be a little bit easier. Okay, so I've done just a basic design there. I'm going to hit next. Now, this is where we're going to get a little bit technical, because now we're actually designing the abutment, but once again, exocad has made it easy. So we can see now I've rotated the model around. I can turn off both of the scan data, so that's my antagonist and my scan, my jaw scan. I'm also going to turn off temporarily the designed crown. I want to show you just the abutment. Now, these pink markers match up with where I just previously marked the emergence profile. So I'm saying I want to stick to that. You can modify it as well. They've made it so easy now to modify the shape of the base of the abutment. So this is you creating a custom abutment. I hope you can see. Michael, is that visible? As I'm changing the slider, you should be able to see the profile of this changing, okay?
Yes.
So this is the kind of design that I would have in the case of an upper central. Very straightforward. One of the things that I also like to do is where we have this bevel, this kind of rolled margin, if I go into advanced, if you watch, I can accentuate it or I can make it disappear. Personally, I like to make it disappear.
Just a remark on the bottoms. If you go back to that step, you can visualize also here, if you click on the checkbox, you can set the threshold for the distance above and below the gingiva. So you can visualize intrusions or gaps between the gingiva and the emergence profile border, but I'm sure you know that.
Yeah, so this is where what Michael's discussing there is that depending on what you had in the position of the implant, so let's say you had a healing abutment, it prescribes the shape. Now that particular shape was very, very good, but they're not always like that. So what Michael is saying there is that you can then apply pressure with this restoration to reshape it. So let's say in the case of a provisional restoration, or even a definitive where you have skipped a provisional step. And you can visualize how much pressure you would have on the soft tissue. Right, I need to just put everything back in because I want to show you what it's doing here. So just like I showed you with the single crown case, what the software just did was it proposed the crown and then it went ahead and moved everything around using auto articulator. And now we have an adjusted crown, which, let me show you proximities and include everything else. We've got an adjusted crown, which just needs free-forming, and then we are finished. So again, I'm going to turn off my model. And as I showed you before, I'm a creature of habit. So I'm going to use my smooth tool first to get rid of all of the rough areas, the lumpy, bumpy bits. This is important for me because we're an aesthetic clinic and we want things to look nice and not just be functional. So when I have a patient sitting beside me, it's important that they know that I recognize aesthetics. And when you show them something like that, especially if you then switch on True Smile, they really get a feel for what you're doing and whether or not you have any artistic flair. So that was me just smoothing that restoration. Now let's have a look at how it looks amongst the rest of the teeth. Over here, obviously that screw channel is a little bit close to the edge of the incisal edge. So if I use my anatomical tools and just go ahead and tweak this, left click and just bring it forwards. Very, very simple, okay? And I'm quite happy with that. Let's say this area here is a little bit too bulbous. I can bring it in like so. So very, very simple tools, easy, and I would describe it as intuitive. I think that's the best way to describe it. I go ahead and click next. Now, where early on in the case, I'll be just 2 more minutes, Michael, where we copied the contralateral tooth, I now have the option to take that tooth that came from the generic library and switch it back to the one that I copied. So if you watch this and I hit adapt to model tooth, the turquoise one is the copy of the contralateral, the white one was the one from the library. And look at what's happened now. The white one has become the copy. If I switch off the colors, you can see that just requires a little bit of tidying up, and now we have something bespoke. It's matching but bespoke, if you know what I mean. Again, same tools, smooth, just to finish off. And just one more step and we are ready to mill this one as well. Any questions coming in, Michael?
No. You can go on.
It seems like I upset a lot of people then, huh?
No,
okay.
I don't think so.
All right, so here we are with our crown. Let's go ahead and put our scan data in. I'm pretty happy with
Just
that.
a couple of feedbacks that you are doing a great job. So that's what some people write.
No doubt there are people that are my customers who are just trying to get their next purchase. Right, okay, there we go. If I click on next, I now get the opportunity to adjust and change my screw channel. To be honest, I rarely need to do anything on that step. So if you wanted to, again, you have control points here whereby you could adjust it and change it to however you want, leave a bevel, leave it above the surface. I always have it matching with the anatomy, okay? And finally, we go into the production blank. Now, I chose, I switched it to a hybrid on purpose because I wanted to show you what you can do with a multi-color material. So this is one of Vita's materials, it's enamic, perfect for any implant crown. The one I fitted a few hours ago from my practice manager was one of these. And the reason being that it can withstand pressure, well, any hybrid can, but also it's aesthetic. So, you know, it's around about a 70-30 split between resin and porcelain. So things to show you here is if I turn up the heat here on layer visibility, you'll see this particular product has 7 shades in it. 1, 2, 3, 4, 5, sorry, 6 shades in it. I should know that. I do work for Vita. So 6 shades in there, and I would challenge most technicians to whether they could grade 6 shades through a single unit like that and still keep it looking aesthetic. So like with the basic crown, you can move this around until you're happy with the positioning so that you can designate which part of it is lighter and darker, okay? Once you've done that, click on next, and it's going to finish the crown ready for milling. There you go. We have an integrated abutment crown. What you would need to do finally there is take your titanium base from your supply company, bond that to that milled restoration, and you have yourself a screw retained crown. And Michael, that's me done.
Yeah, thanks a lot. That was really great. In 20 minutes, you did a crown and a screw retained abutment. That's fantastic. So
Okay.
Thank you for that. I really appreciate. Oh, there's yeah, somebody was just asking if that was just a screw retained crown. Yes, of course. There's also an option to design the custom abutment and the secondary crown in one workflow. Yeah, unfortunately today we do not have the time to show that. Also, you could visit our channel on YouTube, and you can find there a tutorial which shows the workflow in the dental CAD software, which is mostly the same as it looks like here in the Chairside software.
Absolutely, yeah. So the same package, if you have the implant module, you can not only do screw retained crowns, but also custom abutments. And, you know, using the tools that are there, you could actually make a custom abutment and a crown and bond them together so they actually become a completely customized two-piece scenario. Good.
Perfect. Yes,
Do you
some
have
people just like to thank you, and
Thank you.
there's no further question. So Nilou, maybe you.
Just the last request I have, the website. Gulshan, sorry.
The website, let's do that
Yeah.
right now. Absolutely, let's do it right now.
Sorry, I'm insisting on it, but I think it's really important
no.
for everyone to know where to find this information.
Can you see my screen there, the browser?
Yes, we can.
So www.exocad.com. When you
That's
go
right.
there and you go to integration, which is in the middle of the screen, and you will see there are two different sets of implant libraries. It's very important that for design, for the restorative element, you choose implant libraries for CAD. If you were using Exoplan for implant planning, then it's the one below. So if we go into implant libraries for CAD, everything is sorted in alphabetical order. So let's say, for example, okay, I clicked on P, I used the Paltop implant system, and there it is. If you went to, let's say, N, you could find Noble Biocare, NT Trading, Norris Medical. So everything is sorted, and you pick what you want out of that library. So when you click on the button, in this particular case for Nobel, there's one library. In some of the others, there are 2 or 3. And the great thing here is that when you then do that download, you will also get an instruction manual as to how to integrate that into your installation of exocad. Or, of course, you ask your reseller to help you with that.
Thank you, Gulshan. It was amazing webinar. I think it was quite interesting for me as well as the attendees to just all the information that you gave us in, I would say, less than 1 hour. That actually shows how fast you can work with Chairside CAD, as Michael mentioned. We would love to have you back on another webinar, so stay tuned, everyone. And
Okay.
And please look at our website for upcoming webinars with other key opinion leaders that we have in mind. And with that, I think we say goodbye to everyone.
Thank you and goodbye.
Thank you.
Bye.